Hey, this is Andy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. This week's education episode is a CEU episode, and we will be talking about everyone's favorite modality, cupping.
Yeah, so make sure you pay attention at the end or scroll down to the show notes to figure out how to get your CEU for this episode.
Yes.
Thank you, Mass General Brigham, which was formerly known as Precision AT. What are we talking about today, Randy?
Yes, so we are going to be talking about cupping, aka myofascial decompression, if you want to be fancy. We'll discuss the physiological effects of myofascial decompression. We'll talk about some of the evidence for using myofascial decompression to treat different musculoskeletal pathologies. And then we'll even talk about some recommended treatment parameters for cupping, because that's not 100% looked at in the literature. So get some stuff out there.
I'm really excited for this episode because I feel like a lot of people just learn cupping from clinicians or preceptors or someone. And it's not talked about a lot of, okay, what are the actual parameters? How long should we actually put it on for?
Yeah. And I mean, when you think about it, it's fairly, I don't want to say new, because in Eastern medicine, this has been used for centuries, but within mainstream media and Western medicine literature, I think this first got really big when Michael Phelps. And I think it was the 2012 Olympics.
Right.
So just over 10 years ago was when cupping just exploded on the scene. So still pretty new within the research world.
It's kind of funny the influence some celebrities have.
Well, it just goes back to the Olympics, First it was KT tape.
Oh, right.
In the 2008 Olympics, and now cupping hit the 2012 Olympics. What's coming in 2024?
BFR.
It could be. The only thing is you don't see it.
Right.
In the play of competition.
Social media.
That's
so what does myofascial decompression actually do?
So before we see what it does, we have to say what it is first. So myofascial decompression is the use of a cup, and this could either be glass, plastic, or silicone, to create what's a negative pressure. Essentially, this is the suction part. This is what's drawing up all your tissue into the cup. Now, the negative pressure that's created within the cup is different depending on the cup you use, right? So if you use glass, right, you have to use a fire. That's the classic fire cup, right? You have to light a fire within the cup before you put it on the skin, because that heat draws the air in, right? So it creates that suction. Right? And then if it's a plastic cup, more than likely it has a suction tube attached to it that you can draw up skin, right? And then the silicone, right? If you press the silicone, put it on the skin, and then let go, right? That draws the skin up, right? Because of creating that low pressure. So all this suction and stuff creates that negative pressure, and at the center of cupping, negative pressure is where it's at. That's how we're getting our effects right there.
So the method and the material doesn't really play as much of a role, would you say?
From what I've seen, there may be some Eastern medicine teachings behind maybe using different materials or using the fire, but at least within the Western literature, there's not that much of a difference.
Okay. So what is their main goal then?
So there's a couple proposed effects within the Western literature as far as what does cupping do and what does myofascial decompression do, right? The kind of first big one out there is the increase in blood flow. So the cup creates this negative pressure, right? Well, that creates tensile forces of the tissues within the cup itself, right? So all the fascia, all the blood vessels that are sucked up into the cup, that's getting a lot of stretch on it, right? Because it's getting pulled by the cup and getting pulled by the body. Right, but on the edges, and I never really thought about this is kind of true, there's a compressive force, right? The edges of the cup, the skin's being forced into that edge, right? So that creates compression. So what's happening is this creates a momentary occlusion around the cup, right? So it's occluding blood from going into the suction part of the cup. If you have a long duration or a higher intensity, this could actually lead to the rupture of some capillaries, right? So what happens is this creates an ischemic environment because no blood's getting in, blood's leaking out, right? So it creates like a momentary ischemic environment.
Mm-hmm.
But once you release the cup, you see a rapid increase in blood flow.
Mm-hmm.
Right? And this is kind of going off of the principle of reactive hyperemia, right? There's been a decrease in blood flow. There's some ischemia. Your body doesn't like it. So once it has the chance to put blood flow there, it's going to rush it there. Hey, let's get it there. All right. So that's how you kind of see an increase in blood flow to the area. It's kind of similar to what we talked about, I believe, in the tissue flossing CEU episode, right? On how floss bands can kind of create that increase in blood flow. It's kind of that same idea. That ischemia also sends signals saying like, hey, we're having some damage here. We need more blood. So essentially all those kind of signaling starts that process of, hey, we need to get more blood to the area that was within the cup.
I kind of explain it to my athletes, like when they ask, if you have a foam roller, you know, you kind of mash those tissues together and there's a lot of compressive forces. Whereas the cup's opposite, where those tissues, instead of being compressed, they're being pulled apart. So it allows for blood flow throughout those channels.
Yep, exactly. There may also be another reason for the increase, or an added reason for this increase in blood flow as well, is because of that increased tensile force, right? It puts a lot of stress on the blood vessels themselves, especially if, okay, you take that cup off, now you're having all this blood rush into that area. Those vessel walls start to get stressed a lot. And that leads to the release of nitric oxide, which is a very strong vasodilator, right? The release of that tells your blood vessels, hey, we need to open up more because we're having a lot of pressure on us right now. I want to relieve some of that pressure. Let's make a bigger tube. All right. And that idea too was discussed in our, like, kind of the compression boot CEU episode. So with this increase in blood flow, right, it's good because you're getting all the good stuff to the tissue, but you can also get the reverse, and we're taking all the bad stuff away from the tissue too. So that's kind of another proposed benefit of increasing blood flow, right? Or especially after exercise, right? You can take away all the bad stuff, all the waste from exercise, and clear that out.
Via lymphatic system?
Yep, via lymphatic system. The next proposed effect for cupping is the ability to decrease pain, which is sometimes it's kind of hard to see because sometimes the cups are hair uncomfortable.
Especially on your calf.
Yes, especially on your calf. For sure. It will, it's not a lot of...
And the IT band.
That's a very tight... that's a very tight tissue.
Right.
Not a lot of suctions happening there. But this tensile stress created by the cup applies that stress to the mechanoreceptors within your skin and within your fascia. So as we've talked about multiple times in, a few of our modality episodes, this stimulation of the mechanoreceptors leads to the inhibition of pain via the pain gate theory, right? Those mechanoreceptors are getting there faster than the pain signal, creating a stimulus to kind of, hey, let's turn down that pain signal a little bit. All right, it's basically the same idea of how TENS kind of decreases pain, right? Kind of same idea, or how like massage can decrease pain.
So this kind of sounds like it is a added bonus, not really like we're going to do this to relieve pain.
Yeah, kind of. Yeah. I think most people use it for that, like, increased blood flow and like some other reasons. But yeah, definitely, like, for some pathologies, this is pretty good, to help decrease pain. It's another way of doing it instead of just massage and mashing the tissue. And it is kind of nice with this modality. You can kind of set someone up and then go do something. Instead of like massage, you're kind of committed to the treatment too.
Right. Same thing with like ultrasound. You're kind of stuck.
Yeah, you're kind of stuck there. Kind of what Sandra was alluding to already is another thing that you'll commonly see cupping used for is, okay, let's get an increase in range of motion. All right. And some of this could be because of that increased blood flow that we talked about. But another part could be the neurological component too. So the same idea of activating those mechanoreceptors explains an increase in range of motion. So because the cup is decreasing pain or decreasing the sensation of discomfort, it decreases the sensation of discomfort with stretching. All right, so stretching's already a little uncomfortable, right? But after you kind of do one set, you notice, hey, I can go a little bit more on the second set. That's the same idea, right?
It's kind of like a pin and stretch.
Exactly. And that too, right? Because remember, the rim of the cup is adding a compressive force. If you add movement with that, you're kind of, stretching some of that that fascial tissue as well. But essentially, that decreased sensation of discomfort with stretching can allow you to gain more range of motion because you're not feeling discomfort at that range. You're feeling that discomfort at a higher range. So hence, increased range of motion. And like I said, there's also the aspect of increasing blood flow. Right? When we've talked about fascia before, right? We talk about that it's like a gel, right? When it's very viscous, it doesn't move. It doesn't move very much.
Fascia is?
Yeah, like the ground substance within fascia. It's very gel-like. It doesn't like to move very much when it's very viscous. Think of it as molasses. Molasses doesn't move very well. But when you increase some blood flow to the area, right, create that friction or the blood flow increased from the signals of cupping, it turns into water. Water-like. And it moves very fast. Very, very, very fast. And smooth. Smooth. Don't worry. Your settings on your podcast did not instantly jump up fast. That was me.
I did not expect any of this.
You didn't see it. You didn't see it coming. And I actually wrote down in the notes, by the way, it be flowing. That's for the hip kids out there.
Yeah.
My basketball guys would appreciate that.
Okay.
So essentially that's how you see that increase in range of motion, right? You're decreasing the pain sensation with stretching, and you're increasing blood flow to the tissues, which helps kind of loosen them, make them less viscous, able to glide a little bit better. I didn't look a ton into this one, but I noticed some articles mentioned it. You can actually see some increase in parasympathetic input. So the tension on the smooth muscle, like within certain vessels that are around the muscles, can actually help decrease muscle tone. So instead of being in that like fight or flight, right, like you're very tense, the idea is, hey, this can help kind of relax that signal being given to the muscle that they have to be like really contracted and like we're really tense right now, to actually kind of relax.
Where would you find
that research?
No, like where would you put that on the body?
You can still do it on the muscles.
Okay, got it. It just has a
because our vessels, do have smooth muscle in them as well. So if you're putting tension on that, it's sending a stimulus. So that's kind of the idea behind it. Like I said, I didn't look a ton of research into that portion of it, but I did see it commonly referenced. So something to look into, and something to keep in mind when you're using cupping as well. And then, of course, we definitely don't want to discount the Eastern medicine view as well. There are a lot of cultural practices behind cupping and how it can affect, certain energies and certain Eastern medicine views of healthcare. I didn't look a ton into that, but that's also another view that, hey, that could provide some benefit as well.
So we talked a lot about research, but let's start to talk about more clinical practice stuff. Like, how does that?
So what does this even mean?
Yeah. What does this mean? All that stuff is really cool, but what does it mean?
Does it work? That's all I want to know. Can I use this for something?
Right.
Well, within the healthy participants, right, which a lot of research tends to be in healthier populations, it's a little iffy when you're talking about how effective cupping is. In particular, the range of motion studies in the literature are very inconsistent when using healthy participants, right? So when you hear that, you're kind of like, oh, well, why am I using it? I mean, come on. But we can dive a little bit deeper into what the literature says. The studies that showed really a no difference between cupping and a control, or cupping and some other modality, were the ones that really only used static cupping, which essentially is the patient didn't move and the cup didn't move. They just put the cup on.
Let it do its magic.
There you go. Right? The studies that actually utilized some kind of motion, whether it was the cup moving or the patient moving, they actually found an increase in range of motion.
I mean, that makes sense.
Exactly. And some of this could be what we were already talking about, right? There's tensile force within the cup. So there's already some kind of stretch being applied to the tissue. But then if you add movement, it's transitioning from a compression on the edge of the cup to then the tensile force in the cup, right? So the tissue underneath or the cup on top is sliding, creating that kind of pin and stretch. All right. So it kind of creates that stretching sensation.
Well, it's the same thing when people like just stretch, like static stretch.
Yeah.
And they are like, for like 20 seconds. And they're like, how come I didn't like get length in my tissue?
Yeah.
And you're like, well, first of all, that you need to stretch longer.
Yeah.
And second of all, you need to go past the point of like what you're maintaining.
Yes.
You can maintain or you can increase. And there's two different parameters for that.
Absolutely. So now going away from like kind of the healthy participants and now kind of going into, okay, let's look at more pathology, right? At the end of the day, we're treating people with some level of discomfort or dysfunction. So the first thing you kind of look at is soreness, right? Oh goodness, all the athletes love. Michael Phelps did it, so I should do it, right?
And he did it all over his back.
We did cupping one time on my swimmers. All of a sudden, every week they kept coming in. Can I get cupping?
No.
Yeah, it became that kind of thing. But essentially, with kind of like that DOMS, cupping is pretty effective at increasing range of motion deficits, right? So if you have a deficit in range of motion, cupping can help you, hey, let's get back closer to our normal. And it actually reduces the pain associated with DOMS. So again, some of that's going through the neurological input and the increased blood flow. It can help improve muscular activity from fatigue. So as you're, see that, the next day, instead of having a lower level of muscle activity, your muscles are all fatigued. All right, the cupping actually helps kind of get it to a higher level. So you can have more normal activation. And all those reasons, again, could be linked to that decreasing of the pain aspect, right? Like if you're uncomfortable, you don't want to activate your muscles that much, right? It can be associated with the increased blood flow. You're clearing some of those inflammatory mediators out a little bit sooner, right? So decreasing some pain. So with soreness, there is some good stuff with cupping. At least in my practice, I don't like using it a lot with cupping. I've seen some kids feel like they're more sore.
Yeah, that cupping probably wouldn't be my first choice.
But I think it kind of depends on your practice. I mean, some of it could be, are they sore from the exercise? And just because they got the cups, they're like, oh, well, I'm sore. Right. But yeah, usually for soreness, for me at least, I'm not a huge fan of using the cups. I like to do that more as a pre. I like using it as a warm up or the next day.
I could see where it's coming from, like stimulating lymphatic system, stimulating drainage, getting, like you were saying, like removing the bad from the tissues. And
yeah, I agree. I like I said, I could see it, and like as a recovery, like I'll do it the next day.
Right.
I wouldn't do it like after practice. We'll do it the next day when they feel a little more tight and feel a little more bogged down. That's a good one. Bogged down.
They're full of them today.
I am. I'm killing it this morning. So now kind of going into more, okay, we're dealing with injuries now. Right. And there seems to be some promise when you look at musculoskeletal injury, right? There's still doing research on actual pathology and like actual patients is really tough because you're not really doing just one treatment on someone okay, there you go. Right. You're doing other things. And plus it takes time to find like a similar group of injured people to research, right? Because remember, research, you need numbers, right? So sometimes that is hard. So there is still a lot that's lacking on true injury, but there are some stuff, right? They took some participants with a hamstring strain, and you consistently see an increase in the range of motion and patient-reported outcome. So the patient is feeling better with this treatment as opposed to no treatment or like a minimal treatment. I think one group was like heat and stretching.
Okay, but like when are they doing that? It's not like you get a hamstring strain and then you cup it.
Off the top of my head, I can't remember when the report time was.
I mean, if they're already doing heat as the control or as a different
No, the heat was the control.
Okay, so if they're doing heat as a control,
they're probably not like super acute.
Right.
But I can't remember the time frame of when these participants came in off the top of my head. But yes, it is when it's outside of the inflammatory phase.
I usually wait for I do cups on hamstrings a lot, but I usually wait until they're out of sharp pain and until they're saying that they are just feeling tightness. And
yes.
then that's kind of like my bridge of, oh, okay, we're feeling tight. It feels like it's going to cramp up on you.
Yeah.
Let's see if we can like change that.
Yeah. I usually do, like my gauge kind of like is like that, where because I kind of feel cupping's a little more of an intense manual therapy, especially the way I like to use it. I don't really like to do the static cups. Like I do like to add more movements.
Do you do scanning?
Yes. Oh, I love scanning.
Did the research talk about scanning at all?
Yeah. Yeah. And one of the ones that showed an increase in range of motion was a moving cup one.
How long do they scan?
It was only like about 5-10 minutes around there.
You scan for 5 to 10 minutes?
Yeah.
That's a long time. Yeah. I was thinking like 30 seconds.
Oh, no.
Oh,
well, I'm sure like it was a treatment time, not like, I'm sure my arm would get tired, but usually the treatment durations are about that.
Well, yeah. But I'm talking about scanning specifically.
Yeah, I don't know how long the cup was actually physically moving.
Okay. That's what I was wondering. I was like, oh.
But yeah, so I like to do a little bit lighter soft tissue first. And then like kind of like what you said, once like the pain's starting to come down and they're not having so much movement discomfort or deficits, then I'll throw in the cupping. So
Right.
But yeah, no, it's the patient does feel better with this treatment, and some of it could be like that. Okay, if you're tight, right? If you feel a bit looser, hey, I feel like I'm getting better. I feel like I'm, doing something. Also, some of the aspect is it is a manual therapy. Patients tend to feel a little bit better when you're doing something to them, as opposed to like if you look at one of the comparisons was heat and stretch. Well, that's not really like you put a hot pack on, they stretch, right? You're not having so much of that clinician-patient interaction.
Well, food always tastes better when someone else makes it for you.
Of course, right? So some of that could also be at play, but it definitely shouldn't be discredited that the cups are obviously providing some benefit for the patient. And if your patients like it, if you're seeing good outcomes with it, why not?
Right.
The next one that you see is neck pain. There's been a few studies that have examined, okay, let's look at how cupping affects neck pain. And multiple studies, again, showed you see a decrease in pain, so decreased discomfort in the neck, and improved function and quality of life. So again, patients are reporting that they are feeling better with this treatment. And the promise is there because you're starting to see studies that are being proposed for knee osteoarthritis. How can cupping help with the discomfort that comes with osteoarthritis? There's some studies that are being looked at for low back pain, right? They haven't been published yet, but they're like, hey, we're working on it. We're trying, right? So you can see that, okay, something's there. This might be beneficial to treating these actual musculoskeletal conditions.
Well, I feel like a lot of this is transferable, like throughout the body.
Oh, 100%. Especially when you're talking about muscular pain, right? I mean, that's truly what this is, interacting with. It's interacting with the fascia, the musculoskeletal system. Like it, that's where it's going towards. So yeah, it would make sense that it would have that effect.
Right.
On multiple pathologies.
If you just think of like the fascial slings, if you think about like low back pain, there's probably so many areas that you can target that would translate to low back.
Oh, 100%. 100%. Right. And that's not even going into the idea of, again, some of the Eastern medicine stuff and looking at acupoints and and the parasympathetic effects. How can that affect just wellness?
Right.
So definitely a lot of avenues you can look at. And if you dive a little bit deeper, you probably can find some pretty cool things.
Did you see anything about cupping and swelling?
Surprisingly, no. No, not off the top of my head, because I've heard that too. Like you create some decompression around the lymph vessels, and then you should be able to push out more swelling, but I haven't really seen that. Some of it, I'm a little unsure because, right, if you create compression, right, within the cup, the fluid's closed off, so it can't go in until you release the cup.
Right, but
so I could see that
like after.
Yeah, once you release it, then everything's like.
Because I'll do like.
Did you like that sound?
It was great.
Thank you.
10 out of 10. I'll do like a symmetrical biphasic motor movement on, like, let's say ankle sprain. I'll do it along the peroneals or like that nerve, so that we get that twitch, the eversion twitch. And then, I mean, it's the same thing as if you would do, I don't know if you guys have seen like the fireflies.
Oh yeah. That's becoming big.
It is. We use them a lot.
Nice.
But like that kind of twitch, and then if you put a cup right at the lymph node right behind like the popliteus area, like that little fossa space. And then usually if I take it off, like I could even do like milk massage with a cup down at the lymph node and then take it off.
Yeah, no, that for sure. I've definitely heard that, and I've seen some people, using it. I'm definitely a big fan when it comes to swelling. If you got the boots, if you got the Normatex or Recover, I like to throw them on that.
Oh, right.
For a little bit. I mean, that's like, one, it is effective, and then two, it's like a 20-15 minute massage. I can go do something else. That's my milking right there. Yeah, I just did it yesterday. Big ankle sprain.
Oof.
That thing is huge. I'm pretty sure if I put a needle in it, swelling would just come right out. That thing is huge. I mean, it is. I believe it's his first time. So, poor guy.
I almost sprained my ankle in the clinic yesterday.
Excuse me?
I just like was walking, or I was standing and I had my feet crossed and I went to walk, and then I just like, boom, inverted my ankle.
Oh my goodness.
It's fine.
It's okay. Workers' comp.
Okay, so let's talk about parameters.
The dangers of work. Yes, the parameters, right? How do we use this?
I was just trying to be a case study.
Yes. Okay, so how do we use cupping? And you know what? As with most new things, there's very little guidance on, okay, what are the true proper parameters for cupping, right? Eastern medicine has a certain view, and then obviously what you kind of see in Western medicine, they're going to be a little bit different. And again, some of it kind of goes to the idea of why they're trying to use the cup. All right. But, that's not to say that there's nothing out there. There are definitely some courses or certifications that, they lay out their recommendations and their kind of system. One that comes off the top of my head, I think Rock Tape has one.
They have their silicone cups.
And the rock pods, I think they call them.
Right.
And then like there's other courses out there that you can do to take like cupping courses, right? But some of the stuff that I found in the literature itself is they kind of divide it into either the pressure intensity or kind of the duration, right? That's kind of how they're judging the parameters on this. And what I really loved about the intensity part, the pressure, is it's really like a Goldilocks situation, right? Too much, well, that's not good. You create too much pain. It's not going to be useful, right? Defeats what you're trying to do anyways. Yeah,
because if the person is like a T-band and you make it too...
Crank that bad boy up.
Yeah, and then they're like tense on the table, just like not being able to relax. It's probably not going to do too much.
And then on the reverse, right? If you don't have enough pressure, well, there's not enough stress to stimulate all the things we want it to do. So now it didn't do anything. All right, so what you're looking for is just right. Just right is just right.
Goldilocks,
right? And it's really hard to judge this because the literature, they're going to give you an objective number, right? And they say about negative 225 millimeters of mercury to negative 300 millimeters of mercury, right? And I know all of us have machines that can measure that for us when we're doing our cupping, right? So how I kind of look at it is a medium amount of pressure is perfect, right? Like I only do a couple pumps, nothing too crazy. You just get some of the skin to come up. I think if you're looking at the cup, maybe like, inch and a half, 2 inches up into the cup.
It also depends on how elastic their skin is.
Exactly, and the tissue as well. So you do want to go off of the patient, right? Like a lot of times when I'm explaining the cupping is like, most of the time it kind of feels weird. It might feel a hair uncomfortable, but it shouldn't be like, ow, this hurts.
Right.
And that's kind of like my gauge. So I think a medium amount of pressure is perfect, right? If it's just like 2 pumps, I think that's perfect for it.
I think, there's not too many times that you're only going to use 1 cup.
Exactly. You're doing multiple.
So I also like to gauge it with the other cups in the area if they have enough tissue to also pull.
Yeah.
Because if you put too much in one cup, then the rest of the cups won't stick.
Exactly. And also too, if you're going to do movement,
right?
If you have a lot of tension into the cup, right, it's going to be harder to move. It's going to be a lot more painful.
Mm-hmm.
And again, that's not what we're trying to do, right? So, like I said, it's really hard to kind of judge what negative 225 to negative 300 is, but just kind of gauge a feel, right? See how much cup or how much tissue is being sucked into the cup. See how the patient feels, right? How can you, if you're trying to move it, does it move pretty easily, right? Like obviously if it's bumpy and the tissue is very pathological, right, that's going to create a difference. But like, is it gliding smoothly because or like it's not being restricted because there's so much pressure in it, right? That's what you're trying to kind of gauge. But with the idea of the higher end of the spectrum, so getting closer to that like negative 300, that higher pressure has a better chance of increasing blood flow.
Okay.
Right. So if your goal in the treatment is, hey, I'm focused on the blood flow portion, a higher pressure is going to be better for that. Not saying like that negative 225 won't. It's just you get a better blood flow increase at the higher end.
Right. Usually what I do is let's say I'm doing like the calf. I'll pick a spot. I put lotion on the entire thing, pick a spot, and then I do like a half pump, just like a little bit. And then I'll scan, so go back and forth along the length of the tissue, and then kind of feel where the tissue gets kind of taut.
Yeah.
And you can either go like superior, inferior, medial, lateral, and then I'll do like wherever the cup gets stuck.
Yeah.
And then I will do a full pump.
Okay.
And then I kind of go along the length of the tissue, like, okay, well, there's that one there, and then I go along the muscle line or along the line of fascia, depending on what I'm trying to target.
Yeah.
And then usually if one falls off, I'm like, don't worry about it.
Usually, with the one that falls off, I'm like, hey, don't worry about it. Because they all get worried. They're always like, it's going to fall. Or, oh, it fell. It's like, no, it's okay.
Yeah. It did its job.
They're plastic. They're pretty durable. Now, if you drop the glass one, I mean, it is thick glass. So, I mean, it does take a lot to break them. But still.
Right.
Still. So the next thing we kind of go into is looking at like the duration now. Okay, how long are we doing this kind of treatment? And this is going to differ depending on what you look at, whether you're taking the Western view or the Eastern view. Because like Eastern, I think I've read somewhere that it's like almost like an hour.
Oh wow.
Treatment time, yeah. Right. Whereas we're not necessarily you're not cupping someone for an hour, at least in the athletic training clinic.
Right.
So,
I've never even heard of that.
So the literature kind of looks at 5 to about 10 minutes.
Okay.
Right. And if you have a shorter duration, you actually see a larger peak increase in blood flow. Right. So that shorter duration, the blood flow increases like to a larger peak, whereas at the longer duration, it kind of like, that peak's not going as high because you're in there for so long. But the longer duration shows a longer recovery time. So that increase in blood flow lasts a lot longer in a longer duration compared to the shorter durations.
Okay, that makes sense.
So it kind of depends on what your goal is. What are you going to have your patient do next? And like, what does the patient like? What are they able to tolerate? So just keep that in mind. Shorter duration, you do hit a higher peak increase in blood flow, but that longer duration, the blood flow is lasting longer.
I usually do 5 minutes and then I'll do movement. Like a couple sets of things.
I really don't use static at all. A lot of times if I'm doing the cups, I'm doing movement. So I'll put them on and I'm like, okay, let's get.
For how long?
Whatever the movement is, I'd say it's probably closer to 5 minutes because I'll do
5 minutes and then 5 minutes of movement.
No, just 5 minutes.
Oh,
like I put the cup on and I'm like, okay, I do your movement.
Oh, you don't do static at all?
Very rarely.
Oh, interesting.
A lot of times for the neck, I will.
Okay.
Because a lot of times I'm treating the trigger points in the neck. But yeah, like for a lot of the other stuff, it's usually movement.
I did not even think about that.
Yeah.
I just always paired them.
Yeah, no, I just, I get it on, okay, let's do our like 2 sets of 10 of like whatever movement. And then, I mean, do they sit sometimes? Yeah. Like if I'm busy and I have them moving and then they're done with their sets, like, okay, go ahead and just relax real quick. I finish up what I'm doing. Then I go over take cups or I have someone else take the cups off.
Right.
But I really do the movement mostly. I like it for that.
I always start with almost like a prep phase.
Like a warm up.
Yeah. No, like just prepping the.
Yeah.
I don't know. I feel like putting cups on and then asking someone to move, they'll like resist you.
Oh, yeah, I got my peeps trained. They're ready. They know. Oh, movement time. Mm-hmm. I'm like, all right, let's get moving.
So then yours really is like a floss band.
Yeah, pretty much.
Yeah. I mean, I kind of just pair the two.
Hey, we have a big saying lately, and when I say lately, like the past couple of days within our athletic training room, motion is lotion. Yeah. That's right. It's pretty good.
Yeah. Original.
Yep. That's right.
So how many references did you use for this, Randy?
I think we got up to about 17, I say.
Okay.
I don't think it was 20. I think it was slightly less.
Okay. But those are on our website. And then we do have an action item. We can't forget that.
Yeah, we always tend to.
I didn't forget this time.
No, you didn't.
What's our action item, Randy?
I would say to sum this up, when it comes to cupping, you want it just right.
Goldilocks.
Right? We're not trying to crush them and like see how much we can suction, even though some athletes really like to do it. Like, more. Can you go? You can go tighter. I'm like, no, hold on, buddy. Right? And then obviously too little is just not enough, right? So
right.
Identify what your goal is and really try and tailor that treatment towards that goal.
Okay. That's a good action item.
Yep.
So like I said in the beginning, this is a CEU episode thanks to Mass General Brigham, formerly known as Precision AT. So Mass General Brigham it will actually still show up as Precision AT on the website and on the provider when you enter it on the BOC. Yeah,
so when you're entering your BOC, if like Precision doesn't pop, the number's the same. The approved provider number is the same. So you're good, right? So when you put it on the BOC, it may come up as Mass General.
Or Precision.
Like if you have an old one, don't worry. The number's the same. It still works.
So go ahead and scroll down to the show notes. If you're watching on YouTube, just scroll down to the description. And we have the link for the episode quiz.
Yep.
And the
course eval.
So just complete those things. It will automatically create a certificate for you. And then you can upload those. So if you are listening to this as it is coming out, currently it is free. If you are listening to it while it is one of our latest episodes, it will be $1. And then any older episode, which we are going to start highlighting those because we've got a lot now. We have a lot of CUs now.
We do. And it's that reporting year.
And it's a reporting year. So make sure you take advantage of all of our CUs. We also have some multi-packs and some bundles. And
share with a friend. Let them know, hey, this is an avenue for some CUs. Mm-hmm. Especially the ones that are kind of procrastinating, getting a little nervous that, I got 50 CUs I got to do.
Right. So, and again, those quizzes are made to be pretty simple. And if you don't pass the first time, you can always take it again.
Yep.
Lastly, this episode is an education episode. We do on AT Corner every other episode as education or stories. As this one was an education episode, next week we are going back to our stories. You can go to our Instagram at AT Corner Podcast to find out what we are doing next week and for future episodes. Yep. You can also join our Facebook group, facebook.com/group/AT Corner Podcast, where we also list what's happening in the future episodes. And we are still working with MedBridge, and you can use code AT Corner for $150 off if you would like more CEU opportunities.
Yep.
Now is actually the perfect time to buy because it's a 1-year subscription. So it will not only count for this subscription or this reporting year, but next reporting year.
The start of the next cycle.
Yes. All right. I think that's all I have.
That's it. Thank you for helping us showcase athletic training behind the tape. Bye.